I'm Mark. I'm a GP near Southampton in southern England and a professor of healthcare at Winchester University. And I'm going to talk to you about supporting transgender people in primary care. And my first message is start neutral, listen to cues and respect the views. And I'm going to tell you things that you probably know, but I might be reinforcing them, enabling you to pass on information or perhaps giving you some new information. And I'm focusing on the transgender group because they are high risk, marginalized and isolated, and some 50% have expressed suicidal ideation. Firstly, pronouns. It's good to use the expressed gender. Try and avoid that subconscious sir that occurs in restaurants, sometimes subconscious, sometimes overt, but can be offensive. Asking about pronouns is okay if you're not sure, and it's actually appreciated. People are grateful. Avoid assuming sexuality from the expressed gender. Try and use your partner. Practice your phrases. Contraception may not be relevant, but sorry, I have to ask you about screening for cervix or prostate, but it's my role. Whether your partner is the same or opposite sex. Think about how you feel. What are your values and your intrinsic biases? We all have intrinsic biases. It's about surfacing those and working with them. And if need, refer to a colleague in the same way that you might do if you were handling someone with perhaps termination of pregnancy or other ethical issues. To make your practice welcome, you could use postcards up on the local notice boards. People who are transgender or LGBT plus will value that and appreciate and understand it. You could have a poster board. You could rotate poster boards for different groups, including transgender, and these will help inform staff, help raise awareness, help inform information about supporting transgender patients for themselves. When you change clinical records, we are allowed to do it without any other requirements. You will be aware that the old records will be lost and have a new NHS number. So you might want to talk to the patient about how they transfer information across and what goes across. If they have a deed poll, it allows them to change their passport and make other changes. Involve the gender identity clinic early. Bear in mind that it takes a long time to get through the system and they are often overwhelmed, that they need more resources to provide an objective, neutral, supportive approach for each patient. You could prescribe medication in the interim, but you maybe feel uncomfortable about this. So work with a gender identity clinic or refer to a colleague who might be able to help. Some, but not all, want surgery, and some only want top surgery, not lower genital surgery. Beware the referral limits for surgery. They may have to go back if they're not through the system and be reassessed at the gender identity clinic. Cis people ask me, why discuss their sexuality in public? I don't if I'm heterosexual. The reason is that they need to raise the profile of a marginalized group. Other cis people will ask, what about toilets? It seems terrible that people should be transgender and using the toilet of one sex or the other. Well, I think there's a right for everybody to be able to sit in comfort and peace if they need to. So there should be sufficient toilet facilities for unisex, single sex, female or male. And a reminder here is the artwork of Mr. Samu about the problems of being a transgender male. So think, how will you make your practice and consultations welcoming for transgender and LGBTQ+ patients? I'll leave you with that thought and thank you very much for listening.